But there's a lot of differences between peds and adult hospice. You think of hospice and most nurses think, okay, they're going to die quickly because you have to be within 6 months or less. That's the criteria, right?
Hmm.
For adult hospice. Peds
Yeah.
hospice, entirely different. They sometimes will stay on service for years and years because since the Affordable Care Act, they're allowed what we call aggressive concurrent care. With adult hospice, and historically with all hospice, you have to quit everything, right? You cannot become a
Hmm.
hospice patient until you agree to stop all the curative treatments, medications, that sort of thing, for the most part. Peds hospice, entirely different. They're allowed to continue, let's say, the chemotherapy, the dialysis, clinical trials, even being on a vent, infusions, you name it, because who wants to be, excuse my language, the asshole to tell the parents you can't try everything out there to try and
Hmm.
save your kid? So the criteria to see if they meet eligibility comes down to if they were to stop whatever their aggressive care is currently, would they then likely die within 6 months? So that looks like
Okay.
if you stop the dialysis, will they die in 6 months? Yes, of course.
So on the surface, it doesn't look much different if the family is still trying to do everything they can to save the child.
Each case is different. Sometimes they know absolutely that this is going to end not in a happy way, and they've accepted that. But other times they're on their path, their journey, right? And they are still trying things and they still have hope. And that's not to say we don't have tragic cases where someone is admitted on a Monday and passes on a Wednesday. That happens. But all in
Mm.
all, they typically will stay on service for quite a long time. And so we get to know the families very well. And hospice in general, I'm a huge advocate of. It's really underutilized, but peds hospice in general, very underutilized. There's not a lot of understanding about it. The struggle is with providers. They often don't want to broach that subject with the patient because then they themselves feel like they're giving up or being a failure. But it's really a beautiful thing because not only do they get the comfort care that they need, but they're also
Hmm.
allowed to continue all of the curative routes. And it's such a multidisciplinary approach. So we have, for example, child life specialists on staff and pastoral care, social work, all these things are components that are required by CMS
Hmm.
for hospice. And so it's very much geared towards a family centered approach. You're including the siblings and everything that's important to the child.
The child never will never fully grasp what's happening to them,
Oh
right?
no, they
And just
often
also
do.
to,
They very often do.
oh,
It
okay,
depends on their age. We can
all right,
have a newborn up
right.
to 21 years of age. So it and that's where the child life specialists come in. They are amazing at helping them understand what's happening to them and what the future may hold in their own terms that they're able to comprehend.
To not fall into a stereotype with hospice, with adult hospice, you can enter hospice and be downgraded back to palliative care, come out of it. It's not a death sentence. Sometimes that's like a stereotype with hospice. I
Nope.
would imagine when you say pediatric hospice, you are still facing the same stereotype. And maybe even those who are informed of what adult hospice is and don't realize that, oh no, we're still going to maintain aggressive care if that's what you want, despite the fact that your child is in hospice. I would imagine that misinformation is out
The
there.
first response for most people is a look of shock and horror because they've never heard of such a thing as pediatric
Yeah.
hospice. And they think that must be the most depressing job in the world. When the reality is that nurses who have worked in peds hospice will tell you, I would much rather do peds hospice than adult hospice any day. Like I said, we definitely have those sad stories that we'll never forget. Absolutely. But
Hmm.
there's also occasionally success stories where the clinical trial has worked and they graduate
Yeah.
off of hospice. And it can be very beautiful and really just an honor to witness it.
I went through it too when you said pediatric hospice. I've been a pediatric nurse in the ER when it was sometimes you're the pediatric nurse that day, or I've had someone on the podcast, she's a pediatric in a burn trauma unit, and even pediatric oncology, you can wrap your head around it. But pediatric hospice, when you said that, I tilted my head. I never thought of that, even though I probably should have.
It's a thing, and
So you're even within,
we
yeah.
need more healthcare workers out there to be aware of it so that when they come across those patients that they think might meet criteria, then you can maybe be the one to suggest it to the provider and open that dialogue.
I'm a big fan of the hospice, especially if your relative has any fighting chance of recovering.
Yeah.
Hospice is a great idea.
Well,
Otherwise,
yeah.
sometimes medicine might be in the way. Oh, let's hydrate. They're dehydrated. Let's hydrate. Sometimes
It's
hydration
not the
isn't
best
the-
route. No.
Sometimes thinking medically is working against the patient, depending on where they are in their health.
Yeah.
I mean, that's where hospice comes in.
And that's a hard flip
But-
if you're going from acute care to hospice.
Mhm.
I struggled with that in the beginning. I would hear these issues and symptoms that patients were having, and my immediate response was, have you tried this? What, can we get some fluids? That is not always the best option for someone at end of life. You're actually prolonging their suffering often.
Mhm.